Welcome to our Lunch and Learn today. Sobriety Court, a path to treating addiction for repeat DUI offenders. Kim Kern from List Psychological Services in Michigan is a licensed master social worker, associate clinical social worker, certified advanced alcohol and drug counselor, and a certified clinical supervisor for the state of Michigan. She will be shedding light on the crucial role of sobriety courts in addressing addiction issues in the community. Kim is a founding member of List Psychological Services. She was the clinical director and site supervisors for many of the List locations for years. She built the medication-assisted treatment program and the substance use disorder services in Cairo, Michigan. Her work with county courts, probation departments, and jails has made the sobriety court program work for Thumb Region clients. This is only a brief synopsis of her skills and contributions to List Psychological Services in Tuscola County, Michigan. Please welcome Kim Kern from List Psychological Services.
All right, thank you. This particular topic is very near and dear to my heart. It has been something that I've been involved with over the last 10 years since the beginning of our sobriety court in our community here. I guess first of all, let's move on to the next slide. Basically what treatment courts are, it's an alternative that provides treatment to people living with serious addiction and mental health issues. One of the things that we've known over the course of time is that mental health issues, substance abuse issues are things that have kept people from being successful in life, but also in their, when dealing with the court system. So you've seen increased recidivism over and over again and just not being able to be successful to get out of the court's kind of fingers, so to speak. So over the last 10, 15 years, there's been over 4,000 different treatment court programs in the United States. They've ranged everywhere from drug court to sobriety courts like the one I'm going to talk about, mental health courts, which are treatment courts that are identified as people with significant mental health issues that keep them from being successful. Family treatment courts, typically centered around substance abuse issues, baby courts, and that is for the women who typically have had repeated histories of babies who are born addicted to drugs of some sort, and juvenile courts for those youngsters who are getting into the legal system at a very young age, veteran courts, and tribal courts. So there's a variety of different courts, and I'm sure there's other ones that these are some of the main courts that have developed over the years. Okay, next slide, please. Sobriety court team is a multidisciplinary team, and it always has your presiding judge, the drug court coordinator, case managers, probation officer, prosecutors, defense counsel, treatment providers like myself, law enforcement representatives, and drug testing representatives. This group, I think, is important to understand, and maybe it's just ours, but we do that free of charge. It is a voluntary team based on individuals who really believe in the process. For those of us who are going to be working with these individuals, it's important to us that we get the best help that they can get. And we believe that the sobriety court team does help with that. The team is expected to consistently attend staff meetings and judicial review hearings. What we do there is we review all new referrals. Part of what I do is provide an assessment of each of the individuals. And I'll get more into that in a little bit, but the team will assess participant progress. They will help to determine appropriate courses of action, whether it's rewards or sanctions. One of the specific things about treatment courts is that the accountability that it provides for people. As we know, working with addiction, accountability is key to being successful. In traditional probation, they could come to some sessions or they didn't have to. There really wasn't a lot of teeth involved in keeping them accountable. So what they've learned over the course of time is the more accountable you make people, the more likely they're going to change their life, the more likely they're going to address the issues that are barriers. And the key over a course of 15 months to 2 years is that their life when they graduate is very, very different than what their life was in the addiction. Or if it's mental health court, when they weren't treating their mental health issues. The team members are expected to attend trainings to stay current on their treatment court best practices. I did not include those best practices because they're incredibly lengthy. But in general, what it is ways to hold people accountable, ways to reward good behavior, ways to turn negative behavior around as quickly as possible. So that treatment court team really spends a lot of time trying to do what is best for that individual. And the thing with treatment courts is not everybody has the same sanctions, because like with our children, not every child responds to the same things. So, okay, next slide, please. All right, so the target population for adult courts, in addition to our sobriety court, is that it has to be adults the age of 17 or older. They are assessed by the court system as being either moderate or high risk for recidivism. And that helps to identify mental health issues, substance abuse issues, vocational issues, medical issues, really encompasses all different areas. And then they're clinically diagnosed with a moderate to severe substance use disorder, and that they have a high treatment need. So one of the things that is very different about this type of treatment court versus traditional court is that I really encourage them to be completely honest. The one thing I didn't mention is that there's a variety of ways that a person can get referred to a treatment court. When a person comes into the system, they can be referred by a judge, by an attorney, by a prosecutor. That's why if they can be referred if they have a high blood alcohol content that is a first offense. It's unusual, because typically treatment courts we see repetitive types of or habitual types of problems. So you usually see your OWI third offense or your OWI second offense with high blood alcohol contents. And I'm talking about a blood alcohol content of a 0.15 or higher. At a 0.08, they can get a drunk driving charge. So it's almost twice the legal limit. Now, they can also be referred if they have, let's say, a first offense, but then they have a probation violation for testing positive. This program, all drug treatment programs, are voluntary. So they can quit at any time. But typically a person wants to come into sobriety court to avoid prison, to get their driver's license back, or, spending long times in a long time period in jail. So it's always one of the things that I ask, because we typically don't want to put someone with a mild to moderate issue into a program that is this intense. And in some of the later slides, I'll explain how intense these programs can be. One thing I want to mention too is in our program, the person has to be willing to give up marijuana, even if it's medical marijuana or any other substance that is potentially habit forming and is not substantiated by a medical doctor. The only way in which a person is allowed to use marijuana or another substance is if they request a hearing and that doctor comes in and substantiates why that is necessary to use for their medical issues. So I think that's something that's very important and that you might run into is somebody who's involved in a treatment court asking, to come in and testify as to why they need to stay on it. Some of those medications, the biggest one in our court is the medical marijuana. Unfortunately, most of the medical marijuana is received online, so we're not able to come up with a doctor who's willing to provide that information. So in our court, at this point anyway, no one has ever been allowed to smoke marijuana while they've been in a treatment court. All right, next frame, please. Okay, so there are typically 4 phases for a treatment program. And again, it runs between 15 months to 2 years. So the phase 1 is the most intensive and the most grueling for a participant. But the reason behind that is so that they are heavy on the beginning and get as much security as possible. So they check in with their case manager weekly. They have court every 2 weeks. They are required to attend individual, group, and possibly peer support appointments weekly. So it is an intensive outpatient program where individual weekly, group weekly, and many times this is very problematic for some folks because it's a lot. Not to mention, we also assess for ancillary services like psychiatric. So if a person is struggling with bipolar disorder or post-acute or PTSD. That could be something that may need to be addressed with appropriate medication. Depression, anxiety, anything that could be identified as barriers in their life, you could potentially see as a component to the treatment, the original treatment program. In addition, an individual is put on a scram tether. That is a tether that can detect immediately if somebody has drank alcohol. And they typically have that on for a minimum of 90 days. They are required to call every morning to see if they need to drug test. And that's typically early on in phase 1, about 3 to 4 times a week. And there is a charge attached to that as well. They have to complete 90 meetings in 90 days. That's 1 meeting a day for 90 days. And it sounds like a lot, and it is a lot, but it's also where people really get their support system established. Most people hate it in the beginning, and probably 90% of the folks that go through the program will tell you at the end, it was one of the most important things I've done. So because they're required to do these things, they really get a vast array of what recovery is all about. They may also get random home visits from police officers to check to make sure there's no alcohol in the home or drugs. And they don't know when that's coming. It just kind of keeps people on their toes. And then one of the rewards for this is that with sobriety court, they are eligible for a restricted driver's license with an interlock device after 45 days. So unless there's some hold on their license, many of them able to drive legally for the first time in many, many years. So it is a huge reward for them. All right, next slide, please. All right, so phase 2 is also a 4-month minimum. And you start to see that some of the intensity starts to decrease. So they check in with their case manager every other week, continue to attend review hearings every other week. Individual and group therapy stays weekly through this phase as well, but individual therapy can decrease if they're doing well. Therapy is really based on what the individual needs, and it's very different from individual to individual. This is typically also the phase where peer support comes into play. And what peer support is a person in recovery who works with the treatment programs, and they meet with the individuals weekly, and they can count that as a recovery meeting instead. So, for example, if through that 90 meetings in 90 days, a person comes to us and says, man, that's not for me. I don't like going to AA. I don't like going to NA. Peer 360 isn't for me. And what Peer 360 is, at least in Michigan, is it is an all-person recovery program. So it doesn't work with the steps like AA and NA does. It takes people who are recovering from mental health issues, from trauma issues, any type of addiction, they can attend these meetings for support. So what we might do if a person says, I just don't like any of these, we can set them up with peer support meetings and they can do some of their support work that way, which we try to eliminate as many barriers as possible to help people be successful. They continue to submit to random drug tests, typically attend 3 recovery meetings a week instead of the 90 and 90. The big difference here is that we really work on developing a relapse prevention plan. And we work on that through individual and group therapy. Again, if they've got other ancillary types of services, we work together with the provider who's providing medications to help support that person in addressing all issues that are going on in their life. Medical issues are no different. If a person is diabetic, working with them and helping them to get their diabetes under control so that their behavior and their mood improves. So really taking into account all aspects of a person's life and to help facilitate in some of the change to make them enjoy a sober life instead of going back to their drinking. All right, the next slide, please. Now, the first 2 phases are pretty intense. And, you know, it's understandable that relapse can occur during this time. Again, if a relapse occurs, it is addressed immediately. It's addressed typically right in front of the other participants during one of the court hearings, because it's important that they see that there are consequences to behavior. And as much as we're a team, we try to involve the participants as they're part of their team as well. So it helps them to support one another if they're struggling to, hey, you know, reach out to me. You don't want to go in front of the judge who's got the robe on. Okay. So phase 1 and phase 2, we kind of expect some slip ups, and the consequences or the sanctions are really dependent on what works for the individual to kind of get them back on track. It's never anything like, okay, you're going to go spend a month in jail for that. It might be 24 hours. It might be 2 days, just long enough to kind of give them some time out to be able to get back on track. We try as much as possible to be positive, even in the sanctions, so that they can figure out what went wrong. Phase 3 is another 4-month minimum. And with phase 3, they have a check-in with their case manager monthly. Now they're starting to get more independent, and they're making more of their own decisions. They're not being held as accountable. They attend court review hearings once a month now instead of twice a month. Their individual and group therapy decreases. Drug testing does not decrease, however. That stays consistent. They are required to attend at least 1 recovery meeting per week. They still could have random home visits. And in this phase, they need to complete community service work hours. So if it's a district court case, which is your misdemeanors, it would be for people who have either their first DUI or their second DUI. Anytime you have a third drunk driving charge, that is considered a felony, and that goes in front of circuit court cases. And they have to do 40 hours of community service. Now, at this point, people are typically working a full-time job. They're back into, society, doing their own thing. And so it can be a struggle for them to have to figure out how to get this community service done. This is also the time where we start to see attitude changes. We see people getting tired of doing this program. They're sober, they want to just be left alone. But it's also where complacency really kicks into high gear. In fact, I just had a group this morning for phase 3, and people struggle because now group is only every other week. Now we've just created a change into their life, and they're struggling with remembering. Okay, they kind of got into a certain habit, and we've kind of changed things a little bit for them. So it's really looking at how do they roll with the changes. As we know, life is full of change, and if we don't learn how to deal with change, the possibility of relapse goes up significantly. Part of what our role is, and I think even the psychiatric providers' role is to take a look at attitude changes, just changes in how they present themselves. Are they attending their appointments? Are they still taking medication? Are they doing what they're supposed to do or what they want to do for their new life recovery? Or are they still just doing things because they have to? And this is really that turning point for them. Are they doing the minimum, or are they doing things because it's their new life? So that was my discussion with the group today, is where do you fall? Are you doing what is best for your recovery and your new life? So a great deal of phase 3 focuses on complacency and what do you want your life to look like once you are done with this program. All right, next slide, please. Then we get into phase 4. Phase 4 is 3-month minimum. It's a check-in with a case manager once a month. It is review hearings once a month, attending individual, group, usually every 3 to 4 weeks. Now we're really starting to work on aftercare planning and what do they want to do once they complete once they graduate from sobriety court. Some people will say, nice knowing you, I'm out of here. Or other people will say, you know what, I think I want to continue with therapy even after I get graduated for a few sessions, just to make sure that my thinking stays the way it's supposed to. It's also a time where we can start looking at, okay, what are we going to do with medications? Okay, you've been seeing our provider now for the last 9 months, 12 months, whatever it is. Everything seems to be stable, so let's move you to your primary care physician. Or, things still are not quite stable. We need to continue here. So let's continue treatment for a while after graduation and keep working on getting that medication straight. Individuals attend an aftercare group once a month. Now, this is something that we've established in order to provide these participants an opportunity to meet with not only their other participants, but also we allow anybody who has ever graduated from sobriety court to attend. So it's just for sobriety court graduatees or participants. Sometimes we get people who have graduated maybe a year or two earlier, and they come in and they share with others some of the struggles that they've had so that they can help prepare these participants for life outside of treatment court. The other thing that it's very valuable for is it allows participants who maybe are starting to struggle, or not actually people who have graduated, who are struggling. It gives them a place to come back and say, hey, I'm struggling. Can I get back into some services? Easy access back into treatment to help them so they don't fall back into the deep addiction. So we have found it serves many purposes, and it's a safe place for them to come and to talk about things. In phase 4, participants continue to submit to random drug tests. They could still get a home visit from a police department to check on, to make sure everything is still going well. They need to pay all of their sobriety court fines and fees. And they have to complete their graduation application and discharge documents. Some of what this is, once they get out of the program, they will need to submit to all of their information to the Secretary of State, in which to try to get their full license back. What we have found over the last 10 years is that is not an easy thing. If while they have had the interlock system, if they have had problems with it, for example, it tested positive. Now, there's many things that can cause it to test positive. Yeast in things like pizza, or a donut. Ironically, honey buns are a big culprit. Everything, bagels are a big culprit to drug tests. There's a number of false positives that can come about. But in any case, it could become a barrier to getting their license back. So for anybody who's in a treatment court that does have their restricted license back, I'd encourage you to help them to, remind them, contact the device folks and let them know what's going on so that they can put a note in there so that the Secretary of State doesn't think that, was a positive for drinking. All right. Next slide, please. Then we get to graduations. Treatment courts have their own way of doing graduation ceremonies. Initially, we were doing graduations every 3 months. And it became, honestly, what happened was COVID. COVID changed how we did everything. And I'll mention that in just a minute. We typically have an informal graduation acknowledgement and a handout of their certificate and their large coin. We have had 175 people graduate from our program. Now we have a formal ceremony twice a year. So all the graduates that completed the program during that 6-month period are invited to come back and to be acknowledged. Typically, this includes a keynote speaker of some sort. It might be another judge. It might be someone from one of the recovery programs, someone who is just a notable person in the area or in the state of Michigan. The presiding judge and also the media comes because it's a huge thing. It really is a big accomplishment. Everyone has to sign a release if they're going to be on air, obviously for confidentiality reasons. But at least in our area, it's a very big deal. Our program is what's called a regional treatment program, and it covers 3 counties. So because we are a rural area, it covers 3 counties. So when the judge, I think one of the nicest things about the graduation is that the judge tells them just how proud she is of them. And it means a lot. It's huge. It's a way to recognize all of their hard work. It reinforces everything that they've done. And it really kind of gives them a boost to continue what they are doing. So graduation is kind of the highlight. Typically, we do mental health and sobriety court together because treatment courts, everyone has a significant ruling course that they have to go through. But the end result is pretty amazing. One of the things that has been so beneficial, and Sarah, if you're here, Sarah has worked with a couple of our folks, and it has made all the difference in the world. Getting on the right medication when a person has a mental health issue, I can't even tell you how important that is in their recovery. So getting all aspects of that person's life that they need improvement on, touching that and helping them move forward in each area is huge. Okay. That is kind of a treatment program overview. Are there any questions?
I have a question.
Okay, great. Thank you, Ty. Go ahead.
I was just wondering, how is that funded? How is this? Is it through the person's insurance or how?
Oh, great question. So the sobriety courts, they get a grant through the state of Michigan for, it's a certain amount. I think ours is like, I don't know, 120,000 or something like that. So the people who run the sobriety court, they write for a grant. So some of the services and some of that is through the grant, but that covers things like the salaries of the case managers, administrator. It also helps people who are indigent. There's a certain amount that they can help cover for each individual. Regarding therapy, that comes from their insurance. And most people are able to be almost completely funded if they have Medicaid of some sort. There's another pot of money through the state, and I don't think all states are the same. but insurances cover the majority. In cases where the participant cannot financially cover the co-payments, then that's what that extra money that the court system received from the grants is used for.
Okay, thank you.
You're welcome.
That was a great question. Any other questions for Kim? I don't know what everyone's background is regarding sobriety and drug courts, but mine was very minimal, and I'm just amazed at the amount of information that Kim Kern was able to share with us. Are there any last-minute questions at this point?
Is this just through the state of Michigan? Because I'm here in Wisconsin.
No, they should have something in your state as well. I'm pretty sure Wisconsin has treatment courts. So they are all across the country. There's over 4,000 treatment courts in the United States. So some are more involved than others. I think Michigan has really taken off, but I know that the Midwest is actually very very supportive of the treatment court philosophy.
I imagine with 4,000 treatment courts, there's got to be one, at least one in every state.
Yeah. And I'll tell you, it's been the highlight of my career. I've been doing this for over 30 years. And one of the most frustrating things that I endured was, how can we help these people when we can't hold them accountable and we can't keep them sober long enough to see that there's a better life out there? This has changed so many people's lives. It's just amazing. It is absolutely amazing to see the changes. So it's been a wonderful experience.
One more question. So once they go through the sobriety court, does that mean that their sentence is lowered, or how does that work?
So typically, this is one area that I think different treatment courts do differently. Sometimes, in some cases, it's okay, if you finish sobriety court, we will take that third DUI and drop it down so it's no longer a felony. Our court doesn't do that. What it does do is, if you're on for a misdemeanor, you are immediately off of probation once you're done. If you're on felony court probation, typically their probation is reduced. I've not seen it yet in Michigan, at least in our court, where they will take away like a felony and move it down to a misdemeanor. I do know some do it though. So that's from state to state.
Any other questions for Kim at this point?
Sandra, can you hear me?
Yes, I can.
Okay. This is Amy Dunham. Kim, I just wanted to thank you for participating in this event. I actually had not heard of a sobriety court and didn't really know much about it. This has been really eye-opening, quite an intense program for someone to undergo, but seems as though could certainly be something that sets them on a course that is definitely much different from what they would normally go back into. I'm also interested in the other courts that you had mentioned in the beginning of your presentation. Some of those are ones that are familiar to me and others are not. So thank you for this very rich presentation. We certainly appreciate it.
Thank you.
And I'm going to echo that. Thank you very much to Kim Kern from List Psychological Services, telling us more about Sobriety Court and how it works in her state. Any last minute questions, anyone?
Hello.
Hi, go ahead.
I have a question for someone who's interested. How do we go about volunteering or becoming involved in this kind of area?
Is there already an established program in your area?
I have to check into it. I just moved. I'm in California.
Okay. I would talk with the probably the circuit court. Most of the courts, that's where it again, it depends. Our district court does mental health. Our circuit court does sobriety court. And we are going to be starting a juvenile court in the juvenile system. So each one of the judges is kind of covering a different court system. But I think if you contact the courts and just let them know that you are interested in participating, if they have the opening, I'm sure they would love to have you volunteer. It's well worth it just to see the growth, and that what you're doing is really, really helping.
Okay, thank you.
And that's a pretty focused volunteer opportunity. I'm guessing that if you just look at general volunteer opportunities in your area, that type of thing may or may not be listed. So probably contacting the court is a good idea.
Yeah.
Okay.
Yep.
Anything else for Kim?
No, I just wanted to say thank you because it was very informative.
Oh, you're welcome. Thank you.
Thanks again, Kim, for your talk on sobriety courts. We appreciate your time. Everybody have a great rest of your day.
Bye-bye.
Thank you.
Thank you.